Let's explore the prominent bony landmarks of the pelvic bone on the right side of the body with a lateral view. First, for context, proximal or superior is up here, distal or inferior is down here, anterior is to our right side, and posterior is to our left side. The pelvic bone is known by a number of names, including innominate bone, coxal bone, os coxa, and in lay terms is often referred to simply as the hip bone. The pelvic bone is actually composed of three bones that fuse together. At the superior proximal end, we have the ilium, or we could say the iliac bone. At the inferior distal posterior end, we have the ischium, or we could say the ischial bone. And at the inferior distal end anteriorly, we have the pubis, or we could say pubic bone. Let's begin with the prominent bony landmarks of the ilium. First, here we have the lateral, or we could say external or gluteal surface of the ilium. The gluteus medius attaches along here, and the gluteus minimus attaches along here. This upper aspect of the ilium is also often referred to as the wing of the ilium or the ala of the ilium. Here we have the posterior superior iliac spine, the psis. Down here we have the posterior inferior iliac spine, the PIIS. On the anterior side, we have the anterior superior iliac spine, the ASIS, and down here we have the anterior inferior iliac spine, the AIIS. Running between the PSIS and ASIS, we have the iliac crest. A number of muscles attach onto the iliac crest, including the external abdominal oblique, internal abdominal oblique, transversus abdominis, latissimus dorsi, and quadratus lumborum. Two muscles attach onto the ASIS. They are the tensor fasciae lati, the TFL, and the sartorius. And one muscle attaches onto the AIIS, and that is the rectus femoris of the quadriceps femoris group. The PSIS is an excellent palpatory landmark for locating the sacroiliac joint. The body of the ilium is considered to be located right here. Continuing inferiorly, distally, we're at the ischium. The body of the ischium is located right here. This is the ischial tuberosity here. We have a number of muscles attaching onto the ischial tuberosity. They are the semitendinosus, semimembranosus, and long head of biceps femoris of the hamstring group, as well as the posterior head of the adductor magnus of the adductor group, and the quadratus femoris and the inferior gemellus, two muscles of the deep lateral rotator group. Over here we have the ramus of the ischium, another attachment for the adductor magnus muscle. And coming back in the other direction, here we have the ischial spine. The ischial spine is the attachment for the superior gemellus, yet another member of the deep lateral rotator group. And the ischial spine is also important because it separates the greater sciatic notch from the lesser sciatic notch. Now looking at the pubic bone, over here we have the body of the pubis. Running along the superior aspect of the pubic bone, we have the pectineal line, which is an attachment for the pectineus muscle, another one of the muscles in the adductor group. Running up in this direction in here, we have the superior pubic ramus, and running downward from the body of the pubic bone, we have the inferior pubic ramus. The inferior pubic ramus meets the ramus of the ischium, and often they are coupled together and termed the ischiopubic ramus. And here we have a foramen, and this foramen is the obturator foramen. The obturator foramen allows passage of the obturator nerve. We are looking at the surface along the obturator foramen here. So along the rim of the surface of the obturator foramen, we have the obturator muscle attaching, and the obturator is yet another member of the deep lateral rotator group. One more bony landmark that we can easily see here is the acetabulum. The acetabulum is the fossa or socket of the hip joint. The acetabulum articulates with the head of the femur. So this has been a review of the prominent bony landmarks of the pelvic bone on the right side of the body with a lateral view. Now that we've reviewed all of the prominent bony landmarks here, let's quiz ourselves. Pause the screen for a moment and see how many of the landmarks you can name. And now, if you would like, pause the screen again and see how many of the attachment sites you can name.